High five. High five.
High five.
High five.
Give a high five to healthcare.
High five.
High five.
High five.
High five.
Hello, I'm Angela Chapman, President and CEO of VGH and UBC Hospital Foundation. I'd like to begin by acknowledging that we live on the ancestral unceded territory of the Coast Salish peoples, the Musqueam, the Tsleil-Waututh, and the Squamish nations. We thank them for having cared for this land and look forward to working with them in partnership as we continue to live and work in this great city together. I'm very excited that you joined us for this YouTube premiere of High Fives for Healthcare. As we all know, it's been an especially challenging 18 months for all of us, and certainly for our healthcare teams. And your support and gratitude has been more important than ever. This campaign, High Fives for Healthcare, is a way to support the health of our community by spreading positivity while fundraising for our healthcare teams. Over the next 30 minutes, you'll see some of the inspiring stories about the amazing and life-changing work being done right here in BC. You'll also hear from some of our frontline healthcare workers who continue to provide world-class care throughout this pandemic. The pandemic put the foundation at the heart of a community response to support frontline healthcare workers, and we were really honored to play that role. The community really came together to show support for these essential workers, from the 7 p.m. cheer to the countless independent fundraisers that showcased creative virtual ways to raise money, and spirits as we all work together to stop the spread of COVID-19. To the high fives we all shared last year with the launch of this campaign. We're thrilled to join you again to celebrate these incredible teams. First up, a conversation I had with Leslie Bonshore, Vice President, Indigenous Health at Vancouver Coastal Health, about the welcoming space at VGH. I'm Angela Chapman, President and CEO of the VGH and UBC Hospital Foundation, and I'm joined today by Leslie Bonshore. Leslie, we've just had a walk through the welcome space. Can you tell me a little bit about it?
The welcoming space is one part of a big initiative across the Health Authority to increase Indigenous cultural safety. Places and spaces are very important. And this was our way of ensuring that we were able to acknowledge the Musqueam, Squamish, and Tsleil-Waututh in this space, acknowledging that this is their traditional lands that we are working on. So each of those posts represents Musqueam, Squamish, and Tsleil-Waututh.
Leslie, can you tell us a little bit more about your role in creating culturally safe places in our healthcare system?
I assist and support the senior executive team, the board, the local nations, our partnership with First Nations Health Authority to ensure that we're taking a system-wide approach to hardwiring the Indigenous lens into everything we do in the Health Authority. That includes how we collect information, how we provide services, how we build our buildings, how we do research. It absolutely touches every part of the health system.
Leslie, can you tell us about why cultural safety, particularly Indigenous cultural safety, is so important in our healthcare system?
I think the best way to answer that is to point back to the UNDRIP, the United Nations Declaration of the Rights of Indigenous People. There's been a long-standing commitment of governments, of leadership across the country actually, to undo some of the effects and harms of the Indian residential school history of this country. We see that in how it turns up for our people in healthcare. So again, just trying to bridge and close that gap between the Indigenous and non-Indigenous people and acknowledging their right to accessing good, safe, culturally appropriate care when they need it.
Leslie, thank you so much for helping us understand cultural safety and its importance today. And thank you for taking us through the welcoming space.
You're welcome.
So to support projects in Indigenous health and like the welcoming space, please go to vghfoundation.ca.
High five. High five. High five.
High fives for healthcare.
COVID-19 has brought a number of often unseen but incredibly important healthcare roles into the spotlight. Respiratory therapists have, in particular, stepped up as a major pillar of care, providing life-saving airway support for COVID-19 patients. Dave's role as a registered respiratory therapist at VGH put him on the front line of this pandemic.
COVID-19 presents quite a unique challenge for patients like Nick. Nick is immunosuppressed because he has a lung transplant, so those lungs belong to somebody else. Now that they're in his body is going to see it as a threat and try and fight it off. So he has to take medication to prevent that immune response that everybody has. And so that predisposes him or puts him at high risk to getting a serious infection from COVID-19 because his body's not going to try and fight it off. Nick received quite a spectrum of care from all healthcare professionals, including respiratory therapists, doctors, nurses, physiotherapists, dietitians, and everyone in the healthcare team. My role with treating Nick was managing the mechanical ventilator when he was in ICU. I would give him suctions and clear out the secretions from his chest as much as we could. Once he progressed to waking up and coming off of ECMO, we worked on breathing trials with him, so we would set up a schedule to figure out what time he would be working on his diaphragm exercises to strengthen that muscle so that he could separate from the ventilator. He finally progressed to the point where he was off the ventilator, and then the next thing that we start to work on is speaking trials. So we work on managing the airway that was in his neck to deflate the cuff and make sure he was strong enough to cough up his secretions on his own. He was able to regain his swallow reflex so that he could cough stuff to the back of his throat and then swallow it or spit it out. Once he was able to talk, then we would work on changing his trach to one without a balloon, and we would just plug it so he could talk all the time and start working on swallowing and eating. And then once he was able to manage that for a couple of days, then we would consider taking it out. ECMO is an important healthcare innovation because it helps patients that have no lung function or inability to survive on a mechanical ventilator. It pulls the blood out of their body and it clears the CO2 from their blood and it gives them oxygen, which the function of that is usually taken care of by the lungs. Yeah, things that we take for granted is talking. When you're on a ventilator, there's an airway in either your neck or your mouth, and there's a balloon that blocks you from getting air up to your mouth and your nose, so you can't talk, can't eat anything. So we talk and communicate all the time, but for him, he's got a silent voice, so you can only see what minimal lip movement he has because his muscles are so weak that he can't articulate a sentence properly. Walking to the bathroom is something that we just do with no problem, but for him, he can't even turn his body in the bed because he's so deconditioned. The process to get off a mechanical ventilator is very, very long. It takes weeks. And when we do these breathing trials or strengthen their diaphragm, they have to breathe independently and they're struggling because it's like going up a flight of stairs like all day long or for however many hours, but they're not moving. So it can be mentally draining as well because they feel like they're working so hard and doing so much exercise, but the rest of their body knows that it's just laying in bed, so it's very confusing. Sometimes it can be difficult for them to want to continue because they think, it's so difficult, such a challenge. I'm just tired of doing all of this. I mean, everybody has bad days. I was an advocate to get Nick off the ventilator because he was starting to progress in the ICU. He was waking up and he was starting to breathe a little bit more on his own, and that was one of the things that a respiratory therapist can recognize early. And so we would mention that in rounds and say we think that he's ready to start his breathing trials, and that would help to separate them from the ventilator. We start off very small, doing 5 minutes at a time, and then from there we build up until they're finally off for 24 hours. Speaking with a tracheostomy in your neck is quite a different experience. The first time we try and get somebody to vocalize, we start off with them just trying to make a squeak like hi, just a basic word, basic sound to help get the vocal cords to re-engage. And then from there we start working on building up more complex words like hello, 2 syllables, or moving up to working on a couple words per breath. The voice is very soft, it's very faded and kind of raspy and dry. It sounds like you haven't had a cup of water to drink in weeks. And then with time, it builds up, it becomes more normal. For some people, it takes a couple hours. For others, it can take weeks. And for other people, it won't happen until the tracheostomy is completely out. So it always feels strange to them. They tell us that this is not my voice, what's wrong, something's going on. Donations to healthcare help fund all of our new technology, and we have a lot of resources that we can treat our patients with, and we can provide them world-class care. At VGH, we have a lot of services that no other sites have, including the lung transplant service. And so a portion of that money will provide equipment to help with the patient care. It provides funding for education so that we can learn the newest techniques to give them the best chance. Thank you for supporting VGH and UBC Hospital Foundation. Yeah. Okay, ready? Okay. High five for healthcare. Was that too fast? High five.
High fives for healthcare.
High fives for healthcare.
High five.
Our surgical teams have continued to provide life-saving surgeries throughout the pandemic, and our clinician scientists have continued to drive research and discoveries that are vital to providing innovative, world-class patient care for all British Columbia. VGH cares for the most complex spinal cord injury patients, no matter where they come from in BC. Dr. Brian Kwan and his team are on the forefront of spinal cord injury research, surgery, and care. Let's hear about what they are working on.
Hello, my name is Tolu Malamo, a PhD student with the Kwan Lab. I joined Brian's team because of my keen interest in neuroscience, specifically spinal cord injury. The lab gives me an opportunity to do research that can have a direct impact on patients after trauma, and my goal is to do research that will advance our understanding and potential treatments. I am studying the effect of some treatments on the amount of bleed in the spinal cord after injury. Your incredible generosity means so much to us at the Kwan Lab, and it's a huge help to my research and career. Thank you.
My name is Aisha, and I am a master's student in the Kwan Lab. I first joined the lab back in 2018 as a co-op student because I am passionate about the research that Brian and his team are doing towards improving the quality of lives of individuals living with a spinal cord injury. My project focuses on characterizing bleeding in the spinal cord after injury, and how the extent of this bleeding may be influenced by clinical interventions. I believe that this study has the potential to inform clinical approaches for spinal cord injury management. Of course, none of this would be possible without your incredible generosity, so we are extremely thankful for all of your support and kindness.
My name's Cameron G, and I'm a postdoc in the Kwan Lab. I joined Brian's lab in January of 2021 because, in my opinion, the lab's research is some of the most promising in enhancing the quality of life for individuals living with spinal cord injury. Specifically, my research examines blood pressure and pressure within the spinal cord in the week following injury, and how we may be able to use this knowledge to enhance recovery.
Hello, my name's Sarah Morris, and I'm a PhD student working with the Kwan Lab. I'm passionate about research which could make a difference to people living with spinal cord injury. Right now, I'm working on developing and testing advanced MRI techniques which could provide more detail about tissue changes in the spinal cord after an injury. We hope that these scans could be used in clinical trials and to inform prognosis for individual patients. Thank you so much for your generosity. Donors like you make my research possible.
Thank you for all your support for the VGH and UBC Hospital Foundation. It has meant a lot to all of us frontline healthcare workers doing research at VGH.
High five.
High fives for healthcare.
High five. High five.
medical needs and patient care did not stop for this pandemic. Our hospital continued to serve patients, and our specialists continued to provide vital support for British Columbians over the past year and a half. Dr. Catherine Isaac is the Patty Cluxton Chair in Breast Reconstructive Surgery. She shares with us a bit about how breast cancer care hasn't stopped.
I'm Dr. Catherine Isaac from the University of British Columbia, and I work at VGH, UBC, and Providence Healthcare. I'm a plastic and reconstructive surgeon and chair of the breast reconstruction program. I am very grateful to all of you for the donations that you've provided to support the VGH UBC Hospital Foundation. During this difficult time, especially over the many years, if you've been supporting us throughout the entire COVID pandemic, or if you're new to supporting the foundation. As healthcare workers, we've been working very hard to maintain the quality of care that we're providing, mainly to the patients that are in need, and whether that be for treatment of COVID or that be for treatment of breast cancer. And that's where the majority of my work is. So I'm providing reconstructive services for patients that are undergoing breast cancer. And unfortunately, during the COVID pandemic, cancer still occurs, and women still need to receive the treatment and the care that they want and desire, even in the midst of a pandemic. And fortunately, through research and through the support that we've received from the foundation, we've been able to become leaders across Canada in developing guidelines and strategies that we've provided to other institutions so that they can learn how we've maintained the reconstructive services during the COVID pandemic. This is really, instrumental for a lot of women, because 1 in 9 are diagnosed per year. So you can imagine the COVID pandemic started in March 2020, and we are now far over a year into this pandemic, and we've had to adjust and adapt in many ways. And so I'm really fortunate to tell you that because of the support that we've received and a lot of the instrumental leaders and administrators at VGH and UBC, we've managed to maintain all of the important services in breast cancer care that our patients really depend on and really needed throughout this entire year and a half, coming up to 2 years now. So I'd like to thank you again for all of your support, and we are exceptionally grateful for really anything that you can do to help us continue to provide the high quality of care that we know our patients deserve. So because we're so used to Zoom and doing everything online, I wanted to give high fives for healthcare.
High fives for healthcare.
High five.
Thank you for supporting VGH and UBC Hospital Foundation.
Finally, as I mentioned, the community support has been pivotal for our healthcare teams. The kind messages scrawled on sidewalks, the signs in windows, and the beloved 7 p.m. cheer have helped to uplift and energize hospital staff and healthcare teams in communities across this province. We're so grateful to them for the work that they do, and so grateful to you for your ongoing support. Thank you for joining us. To learn more about how you can support healthcare in BC, visit the page on your screen. You can check out the link in this description box below. High fives for healthcare.
High five.
High five.
High five.
Give a high five to healthcare.
High five.